Professor Bob Carner. An absolute delight to have you here. We obviously crossed paths, I think about 16 years ago. You're certainly a titan in the industry, so it's you're going to be bringing a lot of insight into both Emerald and this whole space in general.
Mm-hmm.
So we'll start off with this actually. You have a lot of experience with energy-based devices. Could you tell us a little bit more about that journey?
Very interesting journey, and thank you very much for having me, Nero. Essentially, I stumbled into the world of energy-based devices because I realized that, quite frankly, attached to the face is the body. And a patient that comes for aesthetic treatments on their face, be it teeth, be it face, they naturally want to then look at other areas of their body that concern them. And so I think it's a natural process for patients and clinicians to want to look past just the obvious and look at other areas that would bother a patient. So I think it was inevitable that I would get involved in energy-based devices to some degree. To what degree, I had absolutely no idea. And I think
Yes.
I'm one of those characters, a bit like yourself, that I can't really go into any area half-heartedly. I've
Yes.
got to really understand it fully. So that has positives and negatives. Let me tell you the negatives. The negatives are that I realize there's just a plethora of devices out there,
Yes.
all claiming to be the next thing since sliced bread.
And you're right, this has bamboozled both clinic owners and patients.
Yes, and this has been a big problem. And I realized the only way I'm going to actually try to decipher what's good and what's bad is I've got to really look into things very closely and deeply,
Yes.
look at the clinical data, if there is any clinical data worth looking at, how robust is that clinical data, and then also talk to professionals that may have also adopted those energy-based devices, because I think that's also very important. Talk to colleagues that have actually utilized those particular energy-based devices and done very well. Hopefully they're being honest. And then you need to formulate your own opinions.
Absolutely, because I know many of our peers and colleagues have been underwhelmed by devices in the non-surgical fat removal space. What are your thoughts about this particular space, both with regard to Emerald and other devices competing with Emerald?
Yeah, very good question. I mean, shamelessly, I would say that I was one of those clinicians that embarked on a journey with regard to fat reduction, getting involved in many devices, claiming to be amazing, and ending up being very underwhelmed.
Yes.
And hence why I made a conscious decision many years ago that I'm going to be a little bit more keen and ask the right questions before I get involved in any other devices.
Yes.
And when we talk about Emerald, I think what we need to understand, this is completely a paradigm shift.
Yes.
By that I mean we need to understand what are we trying to achieve as a clinician and as a patient when we talk about fat reduction. Are we trying to kill fat cells? Because that's what we've been led to believe is the sort of gold standard. Kill all the fat cells, nuke them all, and be done with them.
Yes.
And we never ask the questions that we should have asked. Is that sustainable? What actually happens long term? Do fat cells regenerate?
Yes.
What we know now, unequivocally, that fat cells do regenerate.
Yes.
It's not a matter of if, it's a matter of when. And so that means that you can pretty much remove most fat reduction type systems from your office that either heat the fat cells up to a temperature that completely obliterates them and causes necrosis, or freezes them to temperatures to effectively do the same thing, because this is not sustainable.
Yes.
And so what makes Emerald very, very different is that we're actually maintaining fat cells. What we're doing is we're converting these fat cells from being lazy fat cells into fully functional fat cells, lean fat cells that actually then have the ability to, through a cascade system of communication, talk to other fat cells in the body and get them to do the same thing. And this is, like I say, a complete paradigm shift.
Because you're right, many do view fat as an organ that has an endocrine
Totally.
function and that it communicates with other fat cells. So if I were to perhaps ask you, knowledge in this field, it's always evolving. What aspects of education do you impart to your patients? And perhaps if I could extend that by asking, what did you impart in the past that perhaps you no longer suggest? And where do you feel, lifestyle trends and so on are
Yes.
going?
Well, again, you're touching on an area that's vitally important. In that, if we're going to win this race, and overcome this problem of obesity, we need to think about a multi-pronged attack. We cannot rely just on energy-based devices or treatments of any sort and think we're done. We've got to make sure that the patient fully understands that there needs to be a lifestyle change. And that's not just from a dietary and nutritional point of view, but also from their activity levels. So it does mean that my patients are given this information, and I'm very firm about this, that this is a teamwork approach, that I need you to be really mindful that if you want the best results and you want sustainable results for the long term, then we need a lifestyle change, we need to think about our diet and nutrition, and we need to get you healthier. Because if I get you healthier, by virtue of just getting you healthier, you naturally will actually burn fat more efficiently. And so this is the beauty. So the Emerald really is a wonderful opportunity to have that kickstart that we all need to get us onto that train for long-term success. And so I'm really excited by this, because not only are we able to fix a problem and get patients motivated, but we can actually have staying power.
Yes.
And we can maintain them at a healthy level. And let's be honest, it's not just about the aesthetics, is it? It's not just about visible fat that we want to reduce. We're talking about...
There's an overall
we're talking about
benefit.
visceral fat. We're not just talking, and most energy-based devices are targeting, areas of stubborn fat that, from an aesthetic point of view, subcutaneous fat. Well, whereas Emerald will actually work at a visceral level.
Wow.
So,
Okay.
now we're opening up a whole new era.
That's always been the challenge, certainly as a surgeon. We can, liposuction the subcutaneous fat, but anything that is deep to the muscle and within the abdomen has always been a challenge. I have a question for you related to that. You're certainly very well known in the industry, and you're well known for practicing what you preach as well, always talking about the gym and a healthy lifestyle. Do patients benefit in any other ways beyond just fat reduction?
Yeah, no question at all, because if we understand the very fact that what we're really looking at is non-thermal energy, and we're really using photons in a very favorable fashion. Photonic energy is very, very useful for all cells to actually improve mitochondrial efficiency. And what that means is, if we understand that mitochondria are the very powerhouse of every single living cell in our body, if we upregulate the production of ATP in our mitochondria, what we're now entering into is a situation where our body can perform much better. Every single function in our body, if you think about every single cell bar maybe red blood cells, contain mitochondria. So we are going to improve the well-being of that patient. Functionality, energy levels, anti-aging itself is linked to mitochondrial inefficiency. So if we actually understand that we're going to improve mitochondrial efficiency on a global level, we're opening up, Pandora's box here. We're in a very favorable way. So we're able to really offer our patients a lot more than just fat reduction.
Yes.
So I make a big play for this when I talk about this in my consultations with my patients, that we're not just talking about fat reduction.
Yes.
We're going to make you sleep better.
Yes.
We're going to improve hormonal efficiency. We're going to improve your insulin sensitivity levels. Yes. We're going to improve your fatigue levels.
You've gone down a very science pathway. So sticking with that, you've mentioned the concept of apoptosis earlier. And you said that this technology is different from those modalities that induce apoptosis, whether it's ultrasound-based or whether it's heat-related, and that includes cooling as well, of course.
Sure.
Could you tell us in a very high level fashion, how Emerald works that makes it different from those?
Yeah, so essentially, if we understand what does the green laser, the 532 nanometer wavelength laser actually do? In short, what we're able to do is actually impregnate the cellular membrane, create little micropores, transient pores, which stay patent for about 48 to 72 hours, to allow leakage, essentially, for want of a better word, of the fat, which then becomes emulsified into the triglycerides, the free fatty acids that actually then pour out of the membrane and are then able to be drained by the lymphatic system. So what we're doing is expediting a process that your body naturally does. If you actually want to lose fat by other means, by exercise and nutrition, what you're actually doing is exactly that on a regular level. You're actually leaking that fat cells. You're using the fat as energy. And that's the beautiful thing. This expedites that process by actually causing those transitory pores to allow exodus of the fat. And that's the wonderful thing. So at a subclinical level, essentially what we're then doing is actually promoting removal, metabolizing of this fat via lymphatic drainage, as I said. And as long as you maintain a healthy lifestyle and obviously good dietary control, what you'll do is expedite that process. So those fat cells will essentially implode and actually get smaller. So you're taking these fat, lazy fat cells and essentially reducing them down to lean, functioning fat cells. And that's easier to maintain for the long term. And that's fact. I mean, there's no question. Anybody who's actually embarked on a healthy lifestyle realizes that actually once they get to a decent level,
yes,
maintenance is actually relatively straightforward. I'm living proof of that.
It's getting over that peak,
correct,
and then that high point after which it's
and if you think about it, how many people do you know that go to the gym, yes, every single day or pretty regularly, and you see them in the gym,
yes,
year in, year out, and they look exactly the same? And these poor people are putting the effort in. And what you realize is it's not that simple. Yeah. You need like I said, a multi-pronged attack.
So good diet,
exercise, good lifestyle, and then why not a helping hand with Emerald? And the way I liken it, people say to me, isn't that cheating? Let's address the elephant in the room. They say to me, is that cheating? I say, well, listen, you're at the airport. Somebody offers you a fast pass to get through security. Are you going to say, no, I'll just queue up and wait like everybody else? You're going to take the fast pass. Your destination is the same. If you think about it, your destination, your outcome, your required outcome is the same. You're just going to get there faster. So I know which path I'd take.
Who wouldn't, quite simply?
So in my world, I don't look at it as cheating. I think of it as just a helping hand and a kickstart to the success that I require.
So it's safe, it's efficacious, and it gets you to your destination even quicker. What's not to like?
Exactly.
Prof. Khanna, thank you very much indeed.
My pleasure.
And we'll be sharing some more insights with our other clips. Thank you.
Thank you very much.